Hey guys, I want to welcome you out. Welcome all our attendees, welcome our panelists here for a discussion. Today we're calling this COVID-19 in Appalachia. We are going to take some time with some local experts, and we're going to look at what's happening here, what the current status is, how we've been impacted, what the numbers are, things our team and many other team members across the region have been doing to address, protect, prevent, mitigate as much of the negative health and economic impacts as we can, protect one another. And so we'll dig into the current status and where things stand as it is today. Obviously, if you've been following this, it changes almost daily, sometimes multiple times per day on recommendations and where things are headed. So this will be a snapshot of today and where things stand. We're also going to be talking about testing and contact tracing, as this is going to be a critical part of the transition back into some level of normalcy. Is we got to have adequate testing, and contact tracing is critically important. And we're going to talk about the risk associated with long-term care facilities, nursing homes, and the risk that's there and what we're doing to address that. And then we'll wrap it up with some discussion around the Healthy at Work plan. I think many of those guidance criteria it's just coming out, and it's probably subject to change. We may do a more detailed session around that in the future as there's more information out there. But we're going to talk about what we know as of today. Again, I'm Jared Arnett. I'm the executive director of SOAR, Shaping Our Appalachian Region. We're a nonprofit here based out of Eastern Kentucky. We have an interesting mission. One is to improve health and economic outcomes, education outcomes in Appalachia, Kentucky. The second part of our mission is to support all those who are working toward those same goals. So we really are about creating other leaders and winners in the region. We're here really to support many of you who are joining the call today, who are out in the field working. And so that's that's our mission. We try to live up to our name and create a network of people who are shaping our Appalachian region and making a difference. It's all about the future, envisioning it, and then doing what we can impact it for the better. Really started out of the downturn in the coal industry. So we've been around about 7 years now, 6 to 7 years since it first started, but really positioned very well. And coming out of this economic and health impact, we had a lot of the pieces in place to begin doing this work. Our entire team's been working remotely for almost 2 months now, but still providing impact and doing our best to support those out in the field. So we have two great guests, co-panelists here with us today that are going to help speak to these issues. They're experts in their field. One, we have Dr. Margo Riggs, who is a CDC liaison. She's an epidemiologist, and she'll speak to a little bit more of her background in a minute. But she has been in the SOAR office for maybe a year, I think, close to a year. Coming up to it, as she has been a partner working alongside our team at SOAR, addressing the healthy communities issues and working with local health department directors, healthcare providers across the region. We're so glad to have her in the region and supporting this work. We also have with us Scott Lockard, who is the director of the Kentucky River District Health Department. He's been in public health. This might be a second career in it, maybe third. I'm not sure, but he is. Man, we are thankful to have him on the ground. You've probably seen him. You've been tracking the things that are happening, in the hazard and surrounding area. I think he's got about 7 counties in that region. He's been doing a great job of keeping the public informed and supporting all the partners there. So we're thankful to have him here with us today. Both Scott and Margo, thank you. Welcome. Appreciate you being here. So we're going to start this off. I will say I've been impacted personally. I'm a partner in a local business. I'm involved in a local church. I'm involved in SOAR, a nonprofit. I've seen the impact of this thing and from many different angles. So we know the difficulties that you're facing and that we're all facing. One thing I will say, we've done surveys to small business owners. We had over 120 responses, and none of those said they were going to close permanently. Many of them said we're going to close for a certain amount of time, said maybe we'll close permanently. I think maybe 5 said maybe. But we just found the resolve in our people to say we're going to get through this. And then we've seen people start new companies, new services, new technologies that are helping in this time. So I just want to thank you all for continuing with that mindset that we're going to get through this. We're going to be stronger on the other end, but we're going to do what it takes right now to support one another, and we're going to do it together. And so with that being said, I want to turn this over to Dr. Margo Riggs. We're going to call her Margo. She's a friend. She has been in Appalachia has it been a year, Margo? Tell me the time.
In June, almost, just coming up on a year.
Yeah, I felt like it had been almost a year. So she's been in our region for almost a year, and she decided the weekend before we were doing a live webinar to go to the Navajo Nation. She's in Arizona now, but she got deployed this weekend. After we planned this session, she's deployed right now for 2 weeks on a team with CDC out in Arizona in the Navajo Nation, supporting and response efforts there. But she is keeping track, and she's been plugged in on the ground many times with our local partners. So I'm gonna turn it over to her and let her share just kind of the current status of COVID-19 in Kentucky, more specifically in Appalachia, Kentucky. Margo, thanks for joining us today.
Thank you, Jared. Good morning, everyone. As Jared mentioned, I'm with CDC, and I've been with SOAR for about a year. I've been with CDC for about 15 years. I'm an immunologist by training, but also now an epidemiologist after going through an initial training program at CDC. And I've been involved in outbreak response, disaster response, and working with stakeholders to help improve capacity for public health nationally and internationally. I've done assignments in Afghanistan, in Haiti, and most recently, prior to coming to Appalachia, I was in Zambia for about 4 years working on helping them build capacity for public health, establishing their National Public Health Institute, and involved in some of their efforts for the Ebola response that is still ongoing in that region, and helping to train and educate and share the best evidence-based practices that we can to ensure communities are safe. And my work at SOAR tags on nicely to some of the work I was doing overseas and CDC over these past 15 years. I'm kind of bringing it all together and helping to serve in a liaison role in the region, supporting local health departments, and initially focused mostly on our biggest epidemic at the time, which was substance use disorder, as well as diabetes and obesity, and encouraging physical activity. So that's the work I've been doing on at SOAR up until the recent pandemic. And once that hit, and particularly when Kentucky saw its first case on March 6th, I've been really focused on helping support the local health departments as much as I possibly can, and liaising between CDC and the state health department, and really just trying to make sure Appalachian concerns and needs are represented, and sort of making sure we aren't lost in the mix with a lot of attention on the number of cases happening in Lexington or Louisville, or making sure they don't forget about us over here and keeping our needs at the forefront. And so I guess that's it, a little bit of a background about me.
It's great. Appreciate you being here, and thankful for the work you've been doing. Scott, you want to give a quick background on your work in public health, and then we'll jump into the meat of the discussion here.
Thanks, Jared. I appreciate the opportunity to be here with our partners at SOAR and working here in Appalachia. I'm getting ready to start my 30th year in public health. So Jared was politely saying earlier, I'm kind of old. I've been around. I'm seasoned and seen a lot of things. I started my career in the Kentucky River District Health Department, and spent the first 15 years of my career here and working out of Hazard. Then I had the privilege to serve as the director of the Clark County Health Department for 12 years, and which is an Appalachian county still. It's one of the transitional counties, and then had the opportunity here 2.5 years basically to come home. And so come back down here. I always had a heart for the people of this region. I think that's one of the keys for us, those of us that are from this area or have chosen to make this area our home. We know how special this area is and how dedicated and hardworking our people are. And so I'm excited to be a part of this panel today to talk to our business community about how we can support them to get back on their feet. And just first, let me say thank you for all that you've done and all the sacrifices you have made to help us flatten the curve and to try to make sure that COVID-19 has not impacted us nearly as drastically as it has some other states in our nation.
Yeah, I think we've seen the positive impact of the sacrifices many of us have made. And so we are going to talk about, current status, and we'll let Margo start us off there with some current stats and statistics about kind of where we stand today. It seemed that Margo may have been having a little connectivity issues. Audio was good. It remained clear. Video was a little lagging, but as long as we keep audio, we're in good shape. So Margo, if you want to kick us off with some stats, that would be great. Also, before we jump into that, there's a Q&A functionality at the bottom. If you're on the webinar, use that. If you have questions specific to either one of the panelists or to myself, put the written questions in there. We'll do our best to address those at the end of our conversation that we have here. You can also, there's a chat function if you want to talk to one another, share resources, links to things that are good. Feel free to communicate with one another and share resources there. But Q&A is going to be the best place for questions to the panelists. If you're joining us on Facebook, feel free to please share, get this message out. This is important. As many people need to hear this as they can. We're doing our best to monitor there. If you post a question on the Facebook live stream, we'll try to get to that. And so feel free to do that. And so with that, Margo, if you want to kick us off with some key stats and kind of current status.
Sure. Thank you, Jared. Yeah, I forgot to mention, yes, I'm in White Rock, Arizona right now, and this is the heart of Navajo Nation. And I have pretty good connectivity here at their capital, but they're pretty remote, even a little more remote than we are in Appalachia. So connectivity is a challenge for these folks out here, just as it is for us back in Appalachia. And I should have also mentioned, I'm from Kentucky. I forgot to mention that. I grew up in Kentucky, in northern Kentucky. I also worked while I was with CDC back in 2007 to 12. I was assigned to Frankfurt. So I was a CDC assignee there and helped serve all around the region and worked over here or over in Appalachia quite a bit during my time as a CDC assignee to Frankfurt. So I'm very glad to be back home again. This is my second time as a CDC field assignee to be back in Kentucky. So I really enjoy being back home. So let me get started with a little bit about the numbers, and thank you, Scott, for pointing out how well everyone has done at flattening the curve. We really have done a great job in Kentucky. I think taking hold of things early on and really trying to establish social distancing, stay-at-home policies, and encouraging everyone and making it as easy as possible to allow that to happen, despite all the hardships that people have undergone because of it. It has saved lives. It truly has. And I thought if it's going to work, Jared, I'll try to share my screen. Is my video still moving along?
Yeah, it's a little glitchy. You can try the screen, and we'll see if how it works. And if we have problems, I'll let you know.
So this is the KY COVID-19.gov. So we're seeing, I think if everyone's heard the governor's updates, we have 1,000 cases, 261 deaths. What I've been doing is tracking it for just our Appalachian counties, so the 54 counties that are part of what's considered Appalachia, Kentucky. And we have about 507 of those cases. So we make up about 10% of Kentucky's cases are coming from Appalachia. And then deaths, I have 38 is the latest count for deaths that have occurred in Appalachia, Kentucky, and that makes up about 15% of the cases that we're seeing overall in Kentucky. And I thought I would mention a little bit, the hotspot in particular has been those congregate living facilities, long-term care facilities, nursing homes. In Appalachia, Kentucky, we have 193 of our cases. So out of just Appalachia, Kentucky, those cases from long-term care facilities make up about 17% of the cases that we are seeing in Appalachia, Kentucky. And the deaths, we have 2 deaths from long-term care facilities in the state, and both of those were in Appalachia, Kentucky. So we're making up about 19% of the deaths overall that are happening. And then, sorry, I think I misspoke a little bit, but of our cases in just Appalachia, 38% of the cases are coming from long-term care. So that number keeps increasing bit by bit. And then the deaths that have happened in Appalachia, Kentucky, 68% of them are associated with long-term care. So we're making up, 15% of the deaths overall in the state, and of the long-term care and deaths in the state, it's about 19% of those are coming out of Appalachia. So, and then the majority of what we're finding just in Appalachia's cases are coming out of long-term care. So that's definitely a hot spot. I think another hot spot is with the jails or any other type of congregate setting. So we're really trying to stay on top of that. And do I still have audio, Jared? I think my video might have left.
Yeah, your audio is good.
Okay, great. And I also wanted to talk a little bit about, the great work we're doing flattening the curve. Those are sort of our numbers. That's where we stand. Those are the statistics that, kind of tell us the bad stuff. But we have been flattening the curve. There were lots of predictive models out there at the onset showing how bad things could have gotten. And there is even a recent paper from University of Kentucky written by some of their economy professors, excuse me, and it is really predicting how bad it could have been if we hadn't done all of the social distancing and taken all the measures and had such great participation from Kentucky as a whole to really do the things we needed to do to flatten the curve. And it saved thousands of lives. The numbers could have been 10 times what they are, what the paper predicted, if we hadn't done what we did. And I think if I'm able to share, I was going to show, this is a recent article from CDC. I'm just going to kind of scroll to the top. Are you able to see that?
Yes.
Okay.
Your screen's working, yeah.
Great. This is from the Morbidity, Mortality Weekly Report. This is a publication that comes out from CDC. So this is sort of a summary of the public health response effort. And what I wanted to do, this is a really nice compare. They're showing that epi curve. I think we're nicely seeing in this epi curve, this is showing daily how many cases we have. And it shows that really big peak that was occurring in late March, early April. This is the nation. In Kentucky, our peak was a little bit behind that in early April, our overall Kentucky peak. And then us in Appalachia, we peaked maybe a week or so after. We probably were at our peak about last week or so. That's when we really saw the largest number of cases in any one day. And what this article summarizes really nicely, I just want to scroll down to this. The summary box on the left, so it's giving you what's already known about the topic, what's added. So this report is really showing how many factors contributed to accelerated spread of COVID during February and March. And it was really associated with travel, importations, although we did lock down in the United States from the West Coast, Asian travel coming in, that didn't happen as quickly as it might have for those coming in from Europe. So we saw a really big hit in New York from that travel from Europe. And then large gatherings, introductions into high-risk workplaces, densely populated areas. These are the things that have contributed to that rapid spread that we saw in March and into April. And if you look at the box on the right, this is really showing New York in particular. And I kind of want to do a little bit of a comparison between Appalachia and New York. I think we're about as far apart in many ways as we possibly can be, culturally and everything. But I think some of the things that we have maybe felt were holding us back a bit as far as moving forward economically and after the decline in the coal industry. Some of those things that have held us back actually helped protect us in a way during this pandemic. And a very much more economically lucrative area like New York suffered greatly because of having that. So I'm just, I guess, finding that silver lining to our cloud here. But if you look at New York, population density, reliance on mass transit, a lot of apartment living, smaller places people live, all of this helped contribute to how rapid that spread. And then look at their domestic and global transport hub ability. So we sort of feel left out a bit, and we want to bring in highways and get more industry and business in our area. But I think not being that main hub is a big factor contributing to us having less cases and less transit through. So it really hit New York hard when they're getting 1 million passengers per week and all that commuting into Manhattan. And then large number of crowded settings with vulnerable population. This is hitting everyone across the United States and the world. Anywhere where you have long-term care, skilled nursing facilities, congregate settings, that's where folks are getting hit the hardest because it's harder to stay apart. It's harder to do the things we know that prevent transmission, staying 6 feet apart, washing our hands, and taking those measures we need to do to keep things clean. It's a lot harder to do in these congregate settings. So that made a really big hit into New York as well. And the last thing in that box, large gatherings. So in Westchester County there in New York, there were large gatherings happening in late February and even into early March. And that really caused big outbreak problems to happen because of not taking the steps they needed to early enough. I think even in some of the documentation I've seen, Kentucky actually started shutting down. Governor Beshear started making those recommendations even a week before New York did. So that just shows how proactive we were. New York was already having cases and they weren't really shutting down and they weren't getting that message from their leaders. And we in Kentucky started doing it, boom, as soon as that first case was identified on March 6th. So those steps have really helped to flatten our curve substantially and have worked. It's worked to help keep us safe. And so I thought I'd talk a little bit about some of the other statistics that you keep hearing about, and just encourage folks to be mindful of what you read and the numbers you see. And I was trying to get my video back on, but it says it stopped. Okay, let's see, I'll start my video. And you hear a lot of things about case fatality rate, infectivity rate, epi curves, these predictive models. What does all of that mean? I think you've seen the flatten the curve. I mean, Governor Beshear pretty much shows it every night. He might have slacked off a bit the last few nights, but you see that bell curve where it shows the epi curve. It's the number of cases happening, the epidemic curve, the number of cases happening every day. And it shows the date of symptom onset when it starts, all the way to the peak when you have the most cases in any given day, and then that decline. And we've really flattened that curve down, and we hopefully are on that decline, but we've been a little more steady state. We've flattened that curve quite a bit, and we're kind of staying steady, which is great that we're not popping up, but hopefully soon we'll see that downward swing like they've seen in some other states. That is really based on the numbers that are happening in any given day. And what we're trying to prevent is a second spike in that curve. We don't want to relax our guidance too soon and then have a bunch of people congregate again and see a second spike. So we're trying to avoid that second spike like he continues to show in the St. Louis example of that model. So we definitely didn't do the Philadelphia curve. We flattened down to St. Louis, but we don't want to be St. Louis and do that second bump up. You're hearing terms case fatality rate, infectivity rate. So we don't really know what the infectivity rate is. That would require us to know the status of every person. And we have ramped up our testing substantially. I think Kentucky is doing really well. I've had colleagues ask me in California, in Georgia, in Virginia, Ohio, they're saying how they see posts on Facebook and they see the drive-through. How is Kentucky doing this? And I think it's a really great collaboration between public-private partnerships. We've really seen that happen. And that's made a big difference in testing availability. So we will not really know the infectivity rate for a very long time until we get antibody testing out there, which is a blood test that sees if you have been exposed or not in the past. The current testing we're doing is seeing if you're actively infected, and that's done with a swab in your nose. But it's giving us great information to help ensure that we're doing the right things to get people to quarantine if they're a contact of a positive, or to isolate if they're a case. And I know Scott's going to talk a bit about that. But I just wanted to talk a little bit about the case fatality rate. So that means how many people are actually dying out of the known cases we have. And the case fatality rate for COVID is a bit higher than flu, quite a bit. It's not quite what something as bad as Ebola is, which you have a case fatality rate of 50–60% of people die when they get Ebola. But we're at about a 4 to 5% case fatality rate as a nation. Kentucky's right around there. We in Appalachia, Kentucky are right around there too. So we're all hovering around that 4 to 5% average. Now, as we know more about the number of those who have mild symptoms, who may be without any symptoms at all, we'll see that percentage of those who die from those who are cases drop a little bit. But just to keep in mind, this is worse than the flu. There was a lot of speculation about that early on, but I do want to reiterate, this is worse than the flu. Yes, it is hitting those high-risk groups harder, but it can impact anyone. And even if you're not elderly, I really want to reiterate, for young people in their 20s, even if you don't succumb to this disease by being hospitalized immediately, we're seeing longer consequences come out of this, where it's causing blood clots, strokes. So even if you're not dying from this disease and this illness, you may have long-term consequences from having been infected. Now, most people, luckily, are healthy enough to fight it, and they recover just fine and do just fine. But I just want to make sure it's not just a disease of old people. It's not a disease of someone with a foot in the grave. It's really taking, some speculation that I've read out there is a decade off of someone's life in those high-risk categories. And that's a decade we're losing their influence, their guidance, and their contributions to our society. So we have to keep up the guidance and recommendations. I think Governor Beshear has really been prudent with that and doing the right thing. And we're already seeing those states that are opening too soon have cases pop up again, or reach their highest number of cases. So their epi curve has popped up again. And we don't want to go there. I think I'll turn it over to Scott now, Jared.
That's great information. Thank you, Margo. I've heard you say a couple times in different meetings we've been in the last few weeks about, as we reopen up, it's not a flip the switch, it's a dimmer switch. It's, slowly, start to test the waters and open things back up. And I think we'll be able to look at more isolated areas where we see things, where we see maybe outbreaks and it start to spread. Which I think gets to what Scott's getting ready to talk about is a critical part of this reopening process is around testing and contact tracing. I'll share just personally, I had some uncharacteristic symptoms a few weeks ago as the Kroger drive-through testings were popping up, and I took advantage of it. I went and got tested, and thankfully, I was a negative, but that was really early stages. And even from that point 2 weeks ago, testing is popping up everywhere around the region now, and free testing and drive-up testing. So I want you to talk a little bit about what's happening there, Scott, and then what happens if you test positive, those types of situations. Give us an outlook on current testing and contact tracing. Maybe share. We've got some public health people on. And some that aren't. So what is contact tracing? Might be a good place to share some info too. So thanks, Scott.
Yeah, thanks, Jared. Testing, we're very excited about the increased testing opportunities. The drive-through testing that was done there at Pikeville with the Kroger partnership, in Hazard with the partnership with primary care centers. We've had drive-through testing last week. And to give you an idea, going into last week, we had 15 cases in Kentucky River District, and we went up by 14 cases last week. So we almost doubled, have we had cases there all along, and just the lack of testing has kept us from reporting those and now seeing that. So I think obviously as we get more testing opportunities, we'll have more positives that are reported. What happens when a person tests positive? Well, the healthcare provider, they report that to the health department. And sometimes there's been some confusion in the reporting process. Different providers, like through the Kroger partnership with Gravity Labs, they're reporting straight to the state Department of Public Health. And then some local providers are reporting straight to your local health department. So sometimes our numbers may not always match the numbers that the governor releases. He may actually be a day ahead of what we're reporting locally, or a couple days behind. And we're just all working to have the most accurate numbers we can and to be as transparent as we can as we get this information out. So once the health department gets notified that a person has tested positive for COVID-19, we will reach out to that individual. First, the healthcare provider will notify them, of course, of their test outcome, and then the local health department we'll reach out to them, and we do what's called contact tracing. Contact tracing is where we ask the individual to try to think about every place you've been and every person you've come in contact with during the last 2 weeks, because basically we're seeing that that's the amount of time, the incubation period, that you could have had COVID-19 and actually been shedding the virus and impacting others for 2 weeks before you test positive. And some individuals actually may not even show any symptoms. They may be what we call asymptomatic. So they won't have a fever, they won't have a cough, they won't have anything to indicate that they have been sick. They just, for a reason, be it their profession or they're curious, they've gone and gotten tested. And so we'll reach out to those individuals that the person identifies they've come in contact with. We always strive to be as protective as we can about patients' healthcare information, and we release as little information as we can. Typically, all we release is age, gender, and county of residence of the individual. In some situations, however, the person may work in a public-facing venue where the public is at general risk. And so we've had this happen in 3 different times already here in Kentucky River District. We had an employee at an Appalachian Wireless cell phone store that had a lot of contact with customers. We had an employee at the Walmart Supercenter in Hazard. And then we had an employee at a local post office. So we had to do a public announcement then just to make individuals aware that they may have been exposed to COVID-19. What we do is we're talking to people who have tested positive. We ask them to do what's called self-isolate. And self-isolation is where an individual is sick, stays away from other people to try to prevent the spread. What we may ask the contacts to do is to quarantine. Or if somebody's waiting on their test results, they may be directed to quarantine. And quarantine, although similar to isolation, they may not have tested positive yet, but we want to cut down on the risk of them spreading that virus to others should they have it. So again, we'll ask that individual, please, stay at home, don't be out in public, and try to limit your contact. Always do the recommendations of frequent hand washing, good oral hygiene. If you have to cough or sneeze, do so into a tissue and then dispose of it. And if you can't wash your hands frequently, use hand sanitizer, as that is always, a good backup, but nothing beats good old soap and water. Social distancing is so important. If you are out in public, to keep 6 feet between you and others at all times, and truly trying to stay healthy at home. I firmly believe this is what's helped us to keep our numbers low. And the amount of testing in our communities here, we, as we look at the map of cases across the state, I guess all except maybe one, I'm not sure Robertson County, if that's Appalachian County or not, but maybe all the remaining counties are actually in Appalachia that have not had a positive case tested. Estill, Lee, Wolf, McGoffin, Bell, Harlan, Elliott, and Robertson are the 8 counties that have no lab confirmed positives. Again, these mountains help protect us. It's been a good thing. We naturally socially isolate. A friend of mine got me a shirt that says, "You stay in your holler and I'll stay in mine." So the low population density numbers helps us out here now, but also too, it may be a lack of testing. For example, I'm coming to you from Lee County today, and according to our records, we only have 37 tests that have been done at local providers here. So obviously we have a need for more testing here in some of our counties, and we're working on trying to do that. So we ask people to monitor themselves for symptoms if they've been asked to self-quarantine, and to see if they do develop symptoms, and reach out to their healthcare provider, go get tested, and then report back to us, and we try to keep check on them. A lot of individuals, in order to stay at home for a couple of weeks, they may need some assistance. So we help them with groceries. We help them do whatever they need to do so that they can successfully quarantine in their home for a couple of weeks there until they're out. Margo talked about our long-term care facilities. Our most vulnerable population are those who are over 60 and who have other health conditions. And so it's been a great concern for us in our nursing homes here. And let me say, I've had the privilege to work with several of our nursing homes in the region, and they're just doing an outstanding job. That's why visitation's limited in the nursing homes right now. And we've actually had another team of 4 CDC professionals who've been working in the Kentucky River District and some of our surrounding counties. They actually went to Jackson County, where the big outbreak is. And then in all of our counties, they've been doing testing in Wolfe and Perry County, and doing training on the use of personal protective equipment throughout the region. So we've had some of the best support in the nation's been right here in Eastern Kentucky, helping us to keep this virus out. And luckily, we've had no positive cases in the Kentucky River District in any of our nursing homes yet. So we've been very pleased about that, because again, that's one of the most vulnerable populations that we've been working with there to try to keep them healthy.
Yeah, they're the long-term care facilities. Margo shared some of the data around that and how they've been a huge impact. There. There's also and we've seen. I've got one question there in the Q&A, related to. And we talked about this, probably not today, but from the beginning, we talked about this in Eastern Kentucky. We have high rates of other comorbidities or other diseases that complicate COVID-19. So high rates of different types of cancer or diabetes or heart hypertension. And so these things complicate it and put us at somewhat of a higher risk population than some of the others. And then, black lung and the impact of the COPD and the lung issues that we have in the region. We had one question that if you've seen any cases or activity or positive cases from coal miners or coal inspectors. I don't know if that's something you can speak to, or you could answer that question real quick before we move on to the next item in the agenda.
I know locally we've seen some cases of individuals who've had COPD, and our age range of cases, our youngest is I believe a 19-year-old, and the oldest individual we had is 76. And so we've seen a wide variety of comorbid conditions, hypertension, diabetes, and other things. And again, it seems like those individuals are most susceptible. I'll go ahead and address another one of the questions that have just popped up there about testing. Is the antibody testing. Margo talked about the difference between the swabs and then the blood to see if a person's ever been exposed. I know anecdotally, I hear from a lot of people say, well, back in December, I was the sickest I've ever been. I tested negative from the flu. I tested negative for strep, and they never could figure it out. I think I may have had it back then. Well, these antibody tests, they'll see if a person was ever exposed to that. And so what we've seen is the FDA has allowed a lot of these tests to come to market that were not actually approved by the FDA, but allowed by the FDA. So the availability and the reliability of a lot of these antibody tests are not exactly where we would like to see them yet. I think Margo would agree with that. And I think the FDA is actually going back and addressing some of that. So before we put a lot of faith in all these antibody tests, we want to make sure that they are reliable and that they are, have got the proven track record to show us, because we don't want false negatives and people to wrongly assume that they've never been exposed when maybe they had. Most of the testing we see out there is available either free or at no cost to the patient. So there's lots of options there. And many of our healthcare providers, if a person has symptoms all along, they've been able to get testing at multiple healthcare providers throughout the region. It's just this asymptomatic testing or the free testing events that we've seen this increase in lately.
One other at-risk group I just want to mention kind of briefly, and it's not necessarily related to direct impact from COVID-19, but we're seeing an uptick in the recovery community, right? The people who are suffering from substance use disorder and have been in, maybe they've been in inpatient treatment for addiction, or they've been in going to outpatient clinics and doing small groups or NA or AA, and many of those in-person convenings have dismissed. And this is all anecdotal. We don't have real, I don't think, enough data yet to say for sure, but we're seeing just from a month to month an uptick in overdose deaths, not just here in Appalachia, but all across the country. There's a TED Talk where a guy, he just positioned and said, addiction is the opposite of connectivity, and just talked about the isolation and what that can bring to people who are, in recovery and fighting through. And so we've seen some wins around that. We've seen, one of our partners in Addiction Recovery Cares launched a new online tool and an app called ARC Anywhere, where you can get in small groups and you can have conversation and you can still be in community. And so we're seeing solutions pop up around that, but it's definitely something we all have to consider, is this kind of, everything has unintended consequences, right? Everything we do, and just think about, and really as citizens, as family members and friends, if you know people who are in recovery, make the extra effort to reach out and check on them and just try to stay connected at a higher level than you may have in the past, because it's a critically important time for them. Anything you want to share on that?
Yeah, I would add to that there that, especially our people with substance use disorder, but it's hard on everybody right now with the health issues, the separation. We are naturally, most of us, social creatures. We like to be around others. We like to congregate. And so I think it's important, the mental health of everybody, reaching out to others, using FaceTime, using Zoom, using these platforms if you have them available. The great thing about these devices, if you dial a number, a person can talk on the other end and you can talk to them too. I think we forget just on the phone, just talking to somebody and say, hey, just want to check on you and see how you're doing. We're seeing a lot of people, I think, because they're so frustrated and other things, I think we see a lot of good coming out in people right now, but sometimes too, we see the opposite. And I think a lot of it is just, I'm a trained mental health professional. I'm a master social worker. So I think about the mental impact on a lot of people right now that are really struggling. So do what you can to stay healthy. We need to unplug sometimes. Now we have a 24-hour news cycle. So it's good to take a walk, play with the dog, go fishing, do whatever you enjoy, gardening, just get out and do something that's good for the mind. You have to unplug, and you have to remember we're going to get through this. This is unlike anything we faced in my lifetime, public health wise, but we're going to get through this, and we're going to come out on the other side. It's just how all we work together, and never forget, we need to be nice to each other and be as supportive as we can as we do get through this.
Yeah, I think we're going to move now to
tag on to.
There you go.
Jared, I was just on to what Scott was saying, and this is on the covid19.ky.gov site. The state health department has done a really good job. These are all resources that are available. The hotline, suicide prevention, domestic violence, there's all sorts of information available if you go to visit state health department's website. It's got just a plethora of information and lots of good links and videos to kind of summarize, explaining things a little better. So please do visit that site.
lots of great resources there. Let's jump real quick to the healthy at home or the healthy at work conversation as we begin to transition over the next few weeks through May, and Governor Beshear's put out dates and kind of timelines of when different businesses can open, and what these the guidance and timeline looks like. I think Scott and Margo, you guys are going to tag team this, have a little bit of conversation. Whoever wants to go first.
I'll share my screen again. I'll share again those resources. So again, on the Kentucky COVID site, this is the plan that the governor has for healthy at work. And I think Dr. Stack, Dr. White at the Department for Public Health, their teams have really done a great job to try to make this work as best they can. Let's keep the curve flattened. Let's watch it go down, and let's do things the right way. It talks about a phased return to work, still doing social distancing, limiting face-to-face interactions as much as possible. And I know Dr. White has a new video up there talking about why do we wear a mask? What are we doing this for? She does a very nice job of showing how to wear it, why we should wear it. There's another video of how to make one if you don't have one. Cloth masks are going to be something we can do to show how much we care for other people. It's covering our germs. I even have one they made for us to have with our uniform that matches our uniform color. This is not about protecting me. I wear this to show that I'm going to protect somebody else from my germs, so that I'm not spraying on them when I'm talking or if I sneeze and don't cover. It's really a civic duty we need to really take seriously and wear that when we're out in public. And you don't have to wear it 24/7. And if you're at work and you're in your own office, you can take that off. You don't have to wear it the whole time. And it doesn't need to be an N95 or a surgical mask. Let's leave those for those who truly need it because of their work is putting them in direct exposure to droplets because of being close to someone who's ill as a healthcare worker or a first responder. But please.
And let me chime in here too with Margo, if I may. You can have fun with your masks. This is an example of a mask I did, that was made by one of our local ladies at a church. If you're a Star Wars mask, here's another example with a hunting theme. So I think SOAR ought to have, share your mask in the most creative design mask contest. We can do different things with these cloth masks and again, express yourself and have fun, in a healthy way.
I think I'd win that one. I've got a green one.
Exactly.
That's very creative.
But at businesses, you should encourage your customers. We can't force them. There's no enforcement. There's no, requirement necessarily. But it does say in the guidance, and the governor said a business may refuse to serve a customer who's not wearing one. Maybe they feel in their business can't keep that 6-foot distance. Maybe there's other reasons, but a business can say they won't let you in and they won't serve you. So, it's not the worst thing. You don't have to wear something that's going to impede your breathing too much. But it's a simple thing we can do. But I would say the number one thing we have to do, besides staying 6 feet apart, is wash hands. Wash hands. We've been hearing this. And I think people feel like they know how to wash their hands, but so many times I've gone in to see trained people not do it the right way or go a little too quick under there. It's really 20 seconds. Sing happy birthday twice. Get under your fingernails, in between your fingers, around your thumbs. Take that time and use it wisely while your hands are under the water, and really use that friction to get anything off your hands. It's so critical. And hand sanitizer if you don't have hand washing available. That's only if you don't have hand washing available. If you're at a facility, you should have a sink running water. That's kind of showing. And getting back to work, restricting common areas. We're going to have to not use the break rooms anymore. We're going to have to eat at their desk. Do a lot of disinfecting. Here in the state guidance, it says that they have the sanitation minimum twice daily. Cleaning everything, anything anybody touches a lot. Doorknobs, credit card machines, shared computer, any surface people touch a lot. And this another requirement maybe that we're going to have to get into this daily temperature and health checks. Employers are going to have to really check on folks to see if they're ill. I think many have gotten into the habit of just coming to work when they don't feel well. That's the old way we used to function. If we had a few sniffles, if we're sneezing, we just take some cold meds or whatever and try to push through and come into work anyway. That is not going to work now, and it's not going to work in the foreseeable future. And I think I'll turn it over to Scott, but there was a question that came in. What do we do if an employee is sick while at work? And the guidance from the state is clear. It says doing temperature checks, and if you have a sick employee, direct them to get to a healthcare provider and be tested. Do not let them remain at work. Do not let them risk exposing others. But Scott, I'll let you take over.
Yeah, and again, the covid19.ky.gov website is the source for all guidance out there. So as you're going, and that they have got the links, all the sites that are supposed to open on May the 11th, they've got detailed guidance for each one of those businesses on this website. They will be adding guidance for retail and houses of worship that will be up on May the 20th. And then May 25th, we're looking at barbers, salons, cosmetology businesses. I know we're getting a lot of calls about the Red River Gorge and different businesses down there. And a lot of these businesses have unique situations. I worked earlier this week with a person who does rock climbing, and she wanted to know about the guidance for her. And again, there's this general guidance, but there is these specific entities. And on the website, it's got a place here for you to submit a proposal. So you can work directly with the Labor Cabinet and the Department for Public Health, and we can work together to help you develop guidance and look at what's specific for your business. None of this is meant to be punitive. The last thing we want to happen is us to get going and us ramp up our economy again and get people coming in, and we see a huge spike in positive cases and deaths, and we have to put the brakes back on. That can cause more harm to our economy than what we're doing right now, and taking this slow, gradual approach and this phased back up, ramp back up approach. So that's the important thing. Reach out to your local public health director. We're glad to talk to anybody about your business, your situation. I have a great team here, my environmental director, my clinical director, and we'll work with any business and try to talk to them about how can we support you to make sure your reopening is successful.
Yeah, this has been great information. The local health department is a tremendous resource. Obviously, they've been probably burning the candle. What's the saying, at the both ends? Whatever that saying is, they've been up early and staying up late, doing this work nonstop at this critical time. And so we're thankful for them. Reach out to them, even if you're a business. They're not just a place, to go to get services. They can really help you at your place of business and help you craft that plan. There's a couple questions here. Transportation is such an issue for many in East Kentucky. They don't have it, or they rely on LKLP or Big Sandy Transportation, some of the public transport we have. How's this being addressed with the drive-through testing?
Yeah, we've worked with LKLP on their safety plans, and Daniel Boone Transit and some of the others, and that if an individual needs to go in to see their medical provider, they will try to provide them transportation. They just need to call, make an appointment, and to go get that done. So we know transportation is a huge barrier for lots of places. And again, that's why we're trying to ramp up more testing sites. One of the things we're excited about too is the potential for rapid testing, where we can get the results back within, about 15, 20 minutes. And we're going to see that become more widespread available too, but we're not there yet.
Question here from Randy Welch about the different levels of acceptance or severity in COVID-19. Knew of an older gentleman had these multiple, had strokes, heart disease. He ended up testing positive, only had a fever for a day. I think, yes. I mean, we see people, I'm not the public health expert, but I think I've heard them say it enough. You can be completely asymptomatic and never have a symptom, or you can be on the other end of the spectrum, regardless of what your other circumstances are.
Exactly. And I was going to add up on the screen, I have create a testing plan as one of the guidances for businesses. I think you as anyone leading a business needs to keep that in mind of occupational health at your workplace. I know this is hard for smaller businesses, but other recommendations are to encourage your business to have a health coordinator, someone there who can be designated to stay up on all the guidance, follow the rules, and make sure that that person can be in touch and guide any employees that do have concerns about symptoms. If they need to be sent home, encourage them to go get tested. If you're able to have testing on your site of employment, make sure you understand how to report that into the local health department and the state health department. We need to really be working hand in hand between our business community and the customers and our local health department and state health department to be able to keep this thing at bay. And I know we're not quite out of the woods yet. And what we really want to do is get this thing under control now. Hope we see that down slope and then get ourselves in a better situation to be better prepared, probably when it comes again in the fall. And we know we're going to have influenza in the fall, and this is more than likely going to be coming back with it. And it's going to make things very, very challenging. And so if we already start practicing these good behaviors and get accustomed to it, it'll make it that much easier to do those things in the fall and hopefully avoid big lockdowns like we've had to see now. Darren mentioned that dimmer switch example. You know, we flipped that switch off. The light switch went off quickly when we found the first case in Kentucky. We are not flipping the light switch back on, just turning everything on all at once. It's a dimmer switch. We're going to slowly lighten up, and we may have to dim back down in certain places when we see outbreaks. Like I think we're seeing the large meat processing places getting hit right now. That has huge implications to our food supplies. And it also is a high risk for those folks working there. So we need to do kind of a balance.
Oh, we may have lost Margo. I think we did. Yeah. I think she was wrapping up there. We had a couple questions here, Scott. If a coworker tests positive, does that mean all workers that have been in the same building should be tested and quarantined?
That's where the contact tracing comes in. We'll find out the level of contact that coworker had with others, and it'll very much, it could vary. It may be the people they worked immediately next to may need to be, but if they're in a big facility and someone was on the other end, they may not need to. But everybody would just need to monitor, and I think that's the key. We have community transmission. Everybody needs to just monitor and be self-aware right now.
Any guidelines for school districts' healthy at work programming? We know they've dismissed, the students for the rest of this school year.
I've been working with all the school districts in my area on graduation plans. How do we handle graduations and award ceremonies and all this stuff? So the State Department of Public Health has been a big help with this, and the Kentucky Department of Education, and all looking at these plans and trying to work. And I have to give kudos to our superintendents, guidance counselors, principals. They're all just trying to make sure that we're honoring what the accomplishments of our students and still respecting what we need to do to keep our residents healthy and safe. And again, kudos to our State Department of Public Health and this administration. Everybody is working together. This is something new for us. Since 1918, the Spanish influenza, we've not seen anything like this. So none of us that are working today lived through that. So obviously it's new territory. All of us just working together, being patient, and we're going to get back where we need to be.
It's excellent information. We're getting close to wrapping up here. We're close to an hour in. I think we've answered all of the questions. We did have one question in the chat about restaurants when they would reopen. We've not seen guidance on that yet, I don't think. So we'll have to keep watching for that. I believe Dr. Connie White had joined us today as a participant. And I thought she might want to just share a few words. I tried. Yeah, there she is. Hey, Dr. White. Great to see you today. Glad technology worked. I was able to get you on the panel. If you wanted to share a few words as we get ready to close up here.
I look like I'm in the witness protection program. You can't see my face. No, thanks to Scott Lockhart and his hardworking team. They're burning the candle at both ends and melting it in the middle is what my mother used to say. So they are working hard to protect everyone in your great area. And thank you to Dr. Riggs. I'm just thought this was tremendous, and y'all packaged it really well. And I wish we could do this. Maybe we take you guys on the road. I wish we could do this in all of our sections of Kentucky. But thank you for all that great work, and thank you for this presentation today.
Thank you, Dr. White. She's a deputy commissioner at the Kentucky Department for Public Health, and long time. She's been in a lot of our events, engaged with SOAR and all of our local health departments, a champion for this work. Very thankful for her. I'll wrap this up just by saying, you know, when SOAR, 2 years into SOAR, when we listened to the entire region, one of the top things when we put together our blueprint for the future of Appalachia, the first of the 7 goals that we put together was around broadband connectivity. And I think the connectivity we've shown how it can positively impact is actually can become necessary for healthy living in rural communities. And so we've seen people leverage it for telehealth. I've seen my doctor. My father-in-law saw his specialist in Lexington, didn't have to drive 2.5 hours. We've seen retail stores who have closed their front door and had their biggest months ever online. We've seen, you know, addiction treatment services and counseling be deployed remotely through technology. We've seen students be engaged in more digital literacy and online learning than ever before. So we're thankful that was a core strategy we've been working on for a long time, and we've made progress on the infrastructure side. Through this process, I think we've proved the value and the benefit of when communities are connected, and those that aren't are suffering in worse ways than many of us who do have connectivity right now. So I think it speaks to let's keep getting people connected. And I think it's probably reshaped all of our mindsets about how we deploy the services and tools that we have. And, you know, we're an organization that does a lot of convenings. And typically we do those physical, and as an afterthought, we'll stream it live. But we're seeing now we're serving a broad territory. I think the emphasis may be backward there, where we can really build a density of people through technology where we can't physically in rural communities. And that comes in entrepreneurship and all kinds of different aspects. So I just want to say thank you to the broadband providers, the people that are kept us connected, both personally so we can communicate with family and friends, but also to continue doing work. Absent that connectivity, I think we'd be in a totally different place, especially in these rural communities. So I'm going to end it there. I'll say we're going to document all these resources, the websites we've talked about today, that Healthy at Work guidance from the governor's office. This will be recorded. It's on our Facebook. We'll also put it on YouTube and have it on our website, theresafuture.org. And we've got a COVID-19 page there for specific details around Appalachia, Kentucky. One of the things we want to build out is this testing. If you want to get tested, we're going to have a page there that tells you where the free testing, the drive-through testing is happening. So any last words from the rest of our panelists? Thank you all for joining today. I think this was very informational. It might be something we might do again in 2 weeks because it really is changing that quick, and we'll do our best to keep everybody updated. Any last comments?
Thank you for hosting.
Thanks.
I'd just like to say thank you, and I will share the information from Kentucky to the Navajo Nation and hopefully help them out here with lessons we've learned. So thank you all.
Sounds great. Thanks, Margo. You be safe. Scott, be safe. Dr. White, thank you for your continued work. Let us know if we can help in any way. All of our attendees, thank you for continuing to do what you can in your own realm of your own world of sacrifices you're making a difference. Let's live up to the name of our organization and shape our Appalachian region. We're going to do it together, or we're not going to do it. So thank you all.
Bye-bye.